Okay, and I'm coming right to the middle. We'll talk about these widgets very briefly. Okay, we're going to spend some time here on the My Clients widget. You'll notice that there's different views, starting with this quick list. So what you're noticing is we're trying to give you quick access to areas of the system or information that you might use. So in my case, I just have Andrew on my quick list. I don't need to access that many patients quite frequently, but in this case, I have a problem with Andy's record. And so I'm trying to work that out, so I keep them on my quick list until that's figured out in my scenario. Okay, clinicians might have a different use case for using this quick list, but at the front office, that's usually what I'm seeing. Okay, you can add people to your quick list right from this widget. So you'll notice there's also a recent list. The system keeps this for me, and it tells me the last time I accessed the record. Okay, from here, I can right click and say add to quick list. So I can add any clients right from here. I can also navigate. Okay, so this is one of our tips and tricks. Use the navigation menu to move through the client's record. It's easier than kind of coming over here every time you want to change what you're looking at for a client and then having to reselect their name. Okay. Over here, you'll also notice there's some assigned and supervisor views that I have. That they probably won't pertain to you at the front office. You'll most likely use just these two front views. Okay, this widget also has this little plus button. Okay, and right now I'm actually going to press it so you can see what this does. This is add new patient, which accesses that patient demographics form I spoke of earlier when we talked about the first menu under the clients area. Okay, so under the clients area, or right from this widget, we can enter a new intake. So let's say you're working the front desk and the phone rings and it's a new referral. Okay, here I'm going to put them into an intake status. That's the status that ClinicTracker uses before the client is what we would say formally admitted or enrolled for ongoing treatment. Okay, we can later change that status to trigger paperwork due dates and things like that. That usually happens after the first appointment. Okay, so for now, we'll leave that in an intake status and we'll come through. I'm going to skip over everything that's not required. Okay, and I'm going to come right over here to the mental health and substance abuse. Your clinic may or may not have these options, but I can say, what kind of referral is this? Is this for ongoing therapy? Is this for substance abuse treatment? Is it for both? Okay, and I can say which one is primary. Okay, up here I can say what kind of service are they coming in for. Your clinic may have different options. Mine just has the one. Okay, and I can say what their primary place of service is. You're noticing that these bold red labels are turning black as I'm going through. You'll also notice that the save and print buttons are grayed out. I'm not going to be able to save or print, so we talked about that under tips and tricks. Okay. Okay, now I'm going to move to this next tab where there's more required information. I need to fill out things like the patient's last name. So I'm going to say his last name is Webinar and his first name is Jim. Okay, and I'll say that he is a male and today's his birthday and he was born in, we'll say 1977. Okay, I'm filling out the required fields so that we can kind of move through this quickly. You can come in here and kind of explore. For the address, I'm just saying unknown. I don't know his address right now. I'll get that from him when he comes in. Okay, and then I can say I don't know his phone number either, but he's going to call me. They're just calling in the referral for right now. Okay, this is where I could say, you know, this is all the outside provider information, or I could collect it later. Nothing's required, so I'm going to keep moving. I'm going to fill out the payer information. So we'll say it's self. And then here under financial, I can fill out information. And then finally, I have this, what we call embedded form, and it has a required field. So this is just a custom tab I have in here. Your clinic probably doesn't have anything like it, but they may have something of their own. Okay, and if you see any red labels on there, you're going to need to fill them out. So I'm just going to fill this with some test data. We'll go ahead and save. So you see, now that all the requirements are filled out, that save button is now available. So I'm clicking there. Okay. Now, one thing I didn't show you we'll do this patient portal account in a second here. One thing I didn't show you as we were moving through on this date field, Okay, some people are like me, they use their keyboard as opposed to clicking with their mouse. So I just like to mention when you're using a date field, you can tab in, use your space bar to select or deselect the date. So I'm just pressing my space bar and you see what happens. Okay, now you'll see that the 5 is highlighted in blue. That means I'm on the 5. So if I wanted to change it, this is where I could kind of come through and press the up or down button. Okay, so I'm just pressing up or down and I'm changing the numbers here. Okay, so I'm moving left and right using the arrow keys, up and down to change the value. Okay, and then you can tab out to the next field.